All right, so I would like to start my presentation today. We want to talk about data quality. We have been talking about what healthcare is, what healthcare data is, how this data come about. Another very interesting component in the introduction to this course is data quality assurance, okay? Data quality assurance is a very important component of data management. We will look at this module in the light of two major aspects. We'll look at the quality assurance, we'll look at the basis for quality assurance, we'll look at the basis of quality assurance, the basis of, in the context of WHO and the National Health Information Management System policy. Okay, remember, those are our two reference materials. We'll always have to refer to Federal Ministry of Health, and we'll always refer to WHO. Remember that. They are also championing the National Health Information Management System, from which we have drawn out this course. Okay, so we'll always keep a link. They are the basis for why we're doing this. So the basis for quality assurance, okay? WHO is saying that all data that you have naturally by some kind of default of some kind, okay, that data may have quality limitations, and what could lead to these quality limitations include missing data, okay? If we go to our health facilities or some data that we've collected, you realize that some are not complete. Most of the times people don't even complete basic data entry from patient interaction, consultation, even a new patient that is being registered. You know, sometimes you miss out the phone number, sometimes you miss out the age or date of birth, you know, and then that makes it incomplete. And then that particular record becomes completely missing from participating in some kind of analysis. Okay, well, we'll see all that later on shortly. So these limitations are very important for us to note. Sometimes there are errors from transcription. Somebody wants to type in 34 and it types in 43. Okay, these are errors, and we need to find a way of ensuring that these errors are minimized to the barest minimum or possibly eliminated, okay, completely eliminated where it is important, okay? So because of the inherent limitations of missing data, measurement bias, human errors, all that, there is need for us to continually assess the quality of data, and that we need to realize that if your health data is not top quality, because ultimately we need this health data to do analysis or measurement of the health indicators, because you know, it is a healthcare indicator, especially in facility level, or the health indicator that is the paramount or the ultimate goal. You know, eventually you find a health indicator, for example, say maternal mortality rate, child mortality, under 5 mortality rate. These are indicators of health that helps policymakers, decision makers, managers, even you who is conducting certain research to be able to make a decision. So, but you need certain raw data for you to get the indicators. Okay, so this raw data should be of top quality. Okay. Now, I wanted to mention very importantly that because the title of this course is Healthcare Data Management, okay, I needed to let you understand that you cannot define data management without including data quality assurance and data quality review, okay? So we've mentioned this before, and you see that in the National Health Information System policy frameworks. And so again, I will draw attention to it that whenever we're talking about data management, remember the last time we brought in a new picture into it, we said, you cannot define data management without mentioning electronic system, either a computer or so. If you have paper documents, sorry, you can't define data management, okay? So the same way, data management is better defined or is completely defined when you mention data quality assurance. And now we'll try to understand what that data quality assurance is. Okay, so how do we manage our data, or how do we undertake quality data assurance in the light of data management? Okay, very important. They also go hand in hand with data quality control and validation. Okay, there are two different things though. We'll see clearly the two difference here. But data quality assurance and data quality control go hand in hand. They all deal with data quality, and they are very important in defining data management. Okay, so let us look at these two key or two segments. I've just put up this slide so that we can differentiate between what quality assurance is and quality control is in terms of data management in a healthcare facility. I will try and demonstrate an example on an Excel file, but let me just quickly describe briefly what it is. You're doing quality assurance as a management tool. You're doing quality control as a corrective tool, okay? Quality assurance is a preventive measure. Quality control is a corrective measure. That's another way of looking at it, okay? Quality assurance is a proactive strategy. You do it before, because that's why it's preventive, proactive, okay? While quality control is corrective, reactive, okay? The job is already done, now you want to check whether the quality is good. Now, before the job begins, for example, before you begin to collect data onto your EMR or into an Excel file that you use to work to determine health indicators or conduct certain analysis, okay? Before the entry and the transcription and all that, if certain validation rules, certain procedures are put into place to make sure that the quality of data is done, is captured properly, that is quality assurance activity. Now, if the data is already being collected, and now you want to try and ensure that what was collected is actually in good state for analysis or for some kind of transformation, you're actually trying to detect whether there's a defect there, and that in itself is quality control. Okay, so these are the two dichotomy of between quality assurance and quality control. I will try and demonstrate that on an Excel file shortly. Okay, so I'm not going to be talking about clinical coding. I'm not a clinical coder, but I have an idea of what clinical coding is. Most of us are not even coding in our facilities. Maybe when we get to question and answer time, I'll find out those who are coding in their facilities. Okay, it's such a tough job now. It is something that we really need to talk about, maybe in a more detailed course. I have a few experts I've interacted with in our profession, professionals in health records and information that are good clinical coders, and that maybe we would have to bring them to speak to us in a separate course. I think that course will be mounted next year. So, because we need to bring this to the fore more and more. Although in Nigeria, the reason why clinical coding is not selling very well is because we don't do our billings with coding. The strength of clinical coding is merged with the billing component or the claims data of the patient, okay? I know of some HMOs that if you don't, put out the code for the kind of diagnosis or the treatment, or, you want to claim, we need to have a clinical code for that particular kind of treatment or services that you've delivered, okay? So these are some of the examples of, clinical quality assurance. Clinical coding, data validation are a typical example of quality assurance measures, okay? You deal with that in the process to collecting data, while for quality control, you deal with that at the time when you want to process the data for analysis. For example, data cleaning, okay? And data transformation. These are things you do to determine defects, determine, alignment or harmonization of your data to what is required for analysis, okay? Whether your data is ready for analysis. So these are typical examples. I hope I will be able to demonstrate this with some few examples on the Excel file I have shortly. Okay, now, data quality and health indicator. Like I mentioned, it's very important. Indicators are measured, okay, and they are estimated, but from raw data. So your indicator would be as good as your quality, as the quality of your data that you have. Okay, so if the quality of data is not good enough, then it will be very difficult to get a quality health indicator at the end of the day. For example, in a facility where there are hospitalization taking place, that's there's admissions and discharges, ultimately we would want to determine the bed occupancy rate. Okay, bed occupancy rate is a very important health care indicator that helps the facility to determine the strength. It helps the facility it helps other assessors of that facility to know the capacity utilization and also the strength of the that facility in terms of hospitalization and all that. Okay, so for you to calculate bed occupancy rate, you need either date of admission, date of discharge. That will help you calculate your length of stay anyway. So, and you need length of stay together with your available bed days to be able to estimate this indicator that we call bed occupancy rate. So just imagine that you didn't capture their date of admission properly, and then maybe you just have the date of discharge. You see the quality of data due to missing data, or maybe you actually placed in your date of discharge as date of admission. And of course, it's going to be very difficult for you to do the subtraction or addition and get a correct value there. So that's just the essence of what we're trying to say. The quality of your data, your raw data as you collected them, are as good as the quality of the indicator that we'll be looking at. So as part of the resources for this module 3, I have added some very important resources. Just a couple of days back, I was with Dr. Mary Bole. He was former director of the planning and research, and he made available to me a document which I have added there. Remember, like I said, documents from the Ministry of Health are there so that we know that these documents exist and that we can participate in contributing to improving on the quality of that document. The document I'm talking about there is a document that describes, it's like a dictionary of terms. Now, some of the concerns have been that some indicators or some terms, some terminologies are a little bit obscure, confusing. Some define it like this, some define it like that. So in Nigeria, we have tried to, there's an attempt to harmonize this definition. So that document is there, and I'll be asking some questions. So I just hope that you'll be able to, lay your hands on that document and answer the question correctly. So there is also the WHO document for indicators. It's important. So I also had to put that document there so that we know that such document exists and that we can lay our hands on it and we can use it, okay? That's just the essence of it. So quality of data, quality of healthcare indicator go hand in hand, and it is very important for us to note this, okay? So I just tried to define what health indicator is here. I got this from the WHO document, okay? A healthcare indicator is the characteristics of an individual or population. Okay, so just by the way, definition so that you will know what it is. I might be asking a question about this in the quiz just to ensure that we are all on the same page. Okay, so very importantly is this site. Okay, many of us may not be familiar with this. That's the reason I always try and bring this to our attention. The WHO site, you can see the link there, has information related to data quality assurance, okay? And I needed us to, visit this site, although I have actually included the 3 key module documents from this site on the platform here, okay? So that we can actually benefit from it, okay? That site spoke a lot about data quality, and it's, in fact, is a reference standard for every developing country such as Nigeria. We need to visit that site and visit that document, okay? If you don't, well, I have a question for that. So the quiz questions are up. By the way, Module 1 quiz is actually up, so you can actually go there and take your quiz. I know most of you should pass. So that site is very important. There's a website on WHO Quality Assurance Toolkit. It has 3 modules, and these 3 modules are broken down into the first module talks about the framework and metrics. The second module talks about discrete desk review. That's you sit in your office and you do your review of data quality, how it is done, and what are the key things you need to look at. The third module consists of data verification and system assessment. Very, very typical, very important tool for facilities, okay? So I wish that we visit this site and we visit this document, very importantly. All right, so let me take a short break now and go to my Excel file and try and demonstrate something, because I believe that it is through demonstration that we can understand what we're talking about. Okay, so let me try and share this Excel file. Okay, so I have an Excel file here. I'm going to do a little bit of demonstration to you on Excel file, because later on we're going to do more of this in the more advanced course of this data management. But I will just introduce a few things to you here. Now I have this Excel file that has some sheets, and these sheets, if you're looking at it, you would see that I have some missing values here. Look at this, age is missing here, okay? Look at this, parity. Parity has to do with the number of children that a woman has delivered, okay? How many child a woman is an obstetric factor, okay? Well, very importantly, as a health records information manager, it is very important for you to be very familiar with terminologies in healthcare. It's very important for you to be familiar with terminologies. These terminologies will help you to learn about what other professionals are doing in the healthcare system, okay? So parity is supposed to be either 0 to 2 to 5, but not 999. So looking at this data, you know that there's an error here, okay? I hope you can see where my mouse is. There's an error there. So this is an error of transcription, okay? And so what I'm trying to do now is I am navigating through the data set, and all I can see through this navigation is trying to do quality control. What I'm doing now is quality control, okay? Because the data has been entered and there are so many errors in it. The errors could have been prevented, okay? Quality assurance for this type of value can be done even on Microsoft Excel using a validation tool, okay? Let me try and demonstrate something that can help us understand this better, okay? So if I go to Data tab, now for this particular entry, yeah, let's get back to this particular entry. This particular entry is 99999. We could have prevented this kind of entry, okay? So if, for example, I had a validation on that cell, okay? I said I'm on Data tab, and then I say data validation, and I say validate data, okay? And then I say, let the value here be whole number, and let the value be between 0 and 10, for example. I'm trying to validate that cell. What it means that I'm trying to restrict that cell to enter only values between 0 and 10, okay? And then I say, okay. All right, so let's look at that value now, for example, and I say 12, and I say enter. You see this sign come up. This will tell you this value doesn't match with the validation restriction cell and blah, blah, blah. So assuming the person who entered that 999 there was sleeping by the time it entered that 999, this will pop up and then he cannot continue. Then his eyes will wake up and then he will now, oh, I didn't do it well. Okay, so he will retry. Maybe he will now look at the sheet from where he's transcribing. He will now realize that, okay, it's actually supposed to be 2. Then he enters 2 and he now say enter. Then he can now move, okay? So the validation of this cell or validation of cells on the sheet is actually a quality assurance protocol. But as I'm looking at it here, now I've seen a missing cell. Now I'm trying to improve the quality of this data. And what I can do is I will go to serial number 10, and maybe it's a performer, or maybe it's a questionnaire, or maybe it's something, and then I'll go and pick up questionnaire number 10 and then look at it and see whether there is age there. Okay, if there is age there that this person missed out, I will now pick up the age and then type it in correctly. This is quality control. Okay, just for us to demonstrate the difference between quality assurance and quality control. Okay, just typical example on this Excel sheet. Okay, so that's a typical example for quality assurance and quality control. You know, I think this should solve for the presentation for today.